talking more about ways we can stop the spread of COVID-19. Joining us via Skype from Abuja is Dr. Mohammed, former Executive Director, National Primary Healthcare Development Agency, currently the Global Program Director, D8 Countries Health and Social Protection Program. Thank you so much for joining us at this time. First, tell us, how would you say we are handling this pandemic in Nigeria?
Yes, thank you very much. Let me also use this opportunity to say good afternoon, Nigerians. I think so far, the pandemic response in Nigeria, one can say we are on course. I'm saying we're on course because I'm sure people are complaining that the numbers are rising. I mean, it's expected, there is a limit, there is a time in which it's expected that the case count will peak and then it will now start reducing. But so far, the responses of the Presidential Task Force on COVID-19, the coordination of NCDC and the Ministry of Health, I think they are doing very well. What we need to do further is to see how we can contain community transmission, because we are now at the phase of community transmission, in which we expect the numbers to multiply. So we need to see how we can contain the reproductive rate of the virus. And so what do I mean by that? I think the effort now should be focused at the community level, because that is where the problem is. Because if we really do not contain it at that level, then we are likely going to see exponential increment in the number of cases. And when that happens, then the burden also will be on our health facilities and also the community. So it's important that we provide some support to states and local governments. So I believe that the primary care healthcare infrastructure is now time to deploy the primary healthcare infrastructure to support local government and states to ensure that we contain the virus at that level, because the fight now is in the front line. And if you are talking of tackling frontline issues, then it's at the primary care level. So, and luckily for us as a country, we do have a track record and history of containing epidemic, and outbreaks. We've done it with Ebola. We've done it with Lassa fever. We successfully also did it with polio. And these infrastructures are all available, particularly when you come to the community level. The polio infrastructure is available. And it was what we used in 2014 to also contain Ebola. So we need to deploy that infrastructure, which is available in every political ward in this country. We've established a community interface with primary care. In every community in this country, we also have DSNO officers that could easily track and trace cases. In every local government in this country, we also have a network of community mobilizers, because at this particular point in time, we need to aggressively sensitize the public. We need to tell them that COVID-19 is real. We need to tell them that to prevent COVID-19, we have to be alert. And in being alert, we need to ensure that we comply with the guideline as advised by the Nigerian Center for Disease Control in terms of social distances.
Dr. Mohammed,
remaining at home as much as possible. And also,
if I might quickly jump in, I just wanted to get your point of view. Yes. The Lagos governor has said that a register will be open, and this is for inspection of businesses, compliance with all of the safety protocols. How do you think that, the state government would do this and ensure that these measures are adhered to? And do you expect other state governments doing the same thing in the wake of relaxation of lockdown?
Yeah, I think I didn't get you right, but if I get, can you say that again?
Yes, so I was asking that the Lagos State governor is saying a register will be opened to ensure inspection of businesses, event centers are complying with all of the safety protocols. How do you expect that the government will do that and ensure that all of these measures are adhered to within this period? That's one of the conditions for lifting of the lockdown totally in Lagos State. And if you expect to anticipate that other state governments will do the same.
I think what is most important is for us to dialogue with individuals, the communities. We need to make the communities aware of the fact that first, COVID-19 is real. Secondly, we also need to make each and every individual know that while the government has its own responsibility in terms of discharging its own obligation as relates to the COVID-19 national response, equally, we as citizens also have our own responsibility. And what is that responsibility as citizens? What are those responsibilities as citizens? First, we need to protect ourselves. We need to protect our family. We need to protect our community. And how do you do that? Is complying with those personal hygiene that have been dictated and advised by health professionals. And also by ensuring that we, as soon as we are leaving our homes, if it becomes necessary, we have to leave our homes, we have to make sure that we have masks. That will protect us and also protect others. And we also need to keep safe distance, so that in the event that you are coming into contact with an infected case, or if you are an asymptomatic carrier, and because we've not done enough testing in terms of knowing who and who has the virus. So if you are an asymptomatic carrier, you don't also infect another person. So the communities, individuals need to know that yes, the federal government, state government, local government have their own obligation to the citizens. But the same way, citizens also have their responsibility. They need to discharge for themselves, their families, and then the community. And I'm sure if we look at it both ways, then it's likely that we'll be able to contain the community transmission. And just as we did for Ebola, and then we did for polio, Nigeria will be commended. But so far, we are doing well. We just need to ensure that aggressively we proactively attack.
Loads of optimism there. We'd like to thank you, Dr. Ado Mohammed, former Executive Director, National Primary Healthcare Development Agency. Thank you for joining us on the program.